Learn about the county's model healthcare plan, convenient family clinics, children's programs, neighborhood and senior centers, transportation services, and more.
Welcome to the Hillsborough Health Series that lets you know about services available to you as the residents. Well, I am Shay Parker, and with me today is Aubrey Arnold, who is the program administrator for the Ryan White program. Welcome, we're glad to have you.
Thank you, Shay. It's a pleasure to be here.
And Lisa Nugent also is with us today, and you are the Care Council administrator as well, is that right?
Yes.
Well, we're so glad to have you both on the show today, and we are excited to talk and learn more about the program and services that you provide. Why don't we start by first talking about this Ryan White program. First and foremost, who was Ryan White?
Ryan White was a very courageous little boy who was born in Kokomo, Indiana. He lived to the age of 18. Ryan was a hemophiliac who was diagnosed with HIV at around the age of 12 from a blood transfusion. This was back during the 1980s when the epidemic was first coming to light in this country, and not a whole lot was known about it. There was a lot of fear and hysteria at that time for those who remember the era and the time the context that was in. And Ryan faced a lot of problems with attending school, for example, and other things that he battled very courageously along with his mother. But he stood firm, and he became kind of like the national poster child for what was happening at that time with HIV and AIDS. And eventually he came to the attention of the media, of course,
right.
And eventually the Congress. And upon his death in 1990, the Congress at that time decided to name a very, very significant piece of legislation after Ryan, which became known initially as the Ryan White Care Act of 1990. This legislation continues to be authorized by Congress, and it's in its fourth authorization at this point. It was last authorized in 2009 by President Obama, and it's currently known as the Ryan White Extension Act of 2009. Essentially what Ryan was able to do, though, was bring awareness to HIV and AIDS back to his story at a time when there was a lot of fear and hysteria around the disease, and not a whole lot was known about it specifically in this country. He also caused the President and the Congress at the time to act when medications were desperately needed and care was desperately needed for those who were infected and affected by the disease. So he brought a lot of initial attention and awareness to HIV and AIDS in the United States.
Oh, he sure did, absolutely. And in fact, I was in the same age bucket as him at that time, and I remember how horrendous it was to hear his story, to learn about this disease. There was a lot of unknowns, but I'm so glad that as a result of all the tragic, if you will, that he had to go through, that things have been so different, right? Which is why you guys are here today, and why people today can have a very different experience if they too were in that similar situation as Ryan was. Is that right?
That is correct, Shay.
And so with the funding that comes from the government, how much do you get pretty much a year? What kind of people do you help? What's the numbers in terms of who you can help with that funding?
Our area, the Tampa, St. Petersburg eligible metropolitan area, or EMA as we refer to it as, we receive about $10 million annually directly from the federal government, which goes to the Hillsborough County Board of County Commissioners, who is the area grantee for this funding. They in turn have my program, the Healthcare Services Department, which I'm housed under, to manage that funding on an annual basis. So what we do essentially is when we receive the award, we make sure that there are service providers across the four-county area who are capable of spending the funding on eligible clients, primarily community-based HIV and AIDS organizations, as well as health departments and other clinic-based organizations that we contract with to provide the services.
Got it.
So we're responsible for making sure that the service provision is out there across the 4-county area. And we provide a host of services. And we also, my office, my team, we're responsible for the monitoring of that funding to make sure it's being spent appropriately.
Sure, absolutely.
And then reporting back on the health outcomes back to our project officer in Washington.
Awesome. And so you mentioned the 4-county area quite a few times. Which 4 counties are those?
We encompass Hillsborough, which has the highest prevalence rates in the area for HIV and AIDS, and also the other metropolitan county of Pinellas, which is St. Petersburg and Clearwater. It also takes in the additional 2 counties to the north, Pasco and Hernando County. So we're kind of unique in terms of Hillsborough County services that because we extend beyond the Hillsborough County borders and we actually encompass a 4-county service area. I think, in fact, we may be the only social service program under the healthcare division umbrella that does so.
Oh, okay, fantastic.
That's one of our unique aspects.
That's awesome. And so we want to hear definitely a lot more about the services and then how one might access the services should they be in need. But first, I want to jump over to Lisa, and I want to learn a little bit about the Care Council. What is that?
So the Care Council is a community group that meets to talk about the funding that comes down from the federal government that Aubrey's office oversees. So our local group is called the West Central Florida Ryan White Care Council, and it's made up of all volunteers who come together from different service providers and people who are interested in HIV and AIDS and people who are living with HIV and AIDS. They come together to do a variety of different things. So there is local control over the money, there's local oversight, and there's community oversight over the money that's coming down from the federal government.
That is awesome. And so what % of the current Care Council would you say is someone living with HIV and AIDS?
We're mandated to have 33% of our planning council, our care council.
That's 1 out of 3. That's fantastic.
Yes. So, and we're actually a little over that right now. So we're actually at about 43% of our current members are people who are living with HIV and AIDS.
And what's good about that, and again, I know I'm saying that's fantastic, and it is because someone who is going through that experience knows best, right? They probably know better than someone who's not going through the experience what the needs are of that target audience. So that is good, very good that we are including them, and they're more prevalent in this particular group in terms of being able to share their voice and sharing the needs of those that really could benefit from the services. So speaking of the services, going back to you for a minute, Aubrey, what kind of services specifically does your organization provide?
We have a variety of services, Shay. Our top priority that we fund, which makes sense given the disease that we're targeting, is ambulatory outpatient medical care, which is essentially primary medical care for our clients who otherwise would be going without potentially. We also fund, and it's also a high priority, medications. We also fund medical case management across the 4, and these services, all that I'm speaking of, all cover the 4-county area.
All the 4 counties, and they all stem from the original legislation.
Correct.
Primarily because that's what Ryan White went through, right? Because of their socioeconomic status, they didn't have the kind of health care they needed during this dilemma. So fantastic. So that's your primary service that you offer, filling in that gap for those.
Filling in the gaps and acting as a safety net.
Okay, makes sense.
Exactly. And a lot of people don't realize probably that we also cover things such as health insurance premiums, copays, and deductibles, which allows someone who has health insurance already in the private market to maintain that coverage. And it's actually much more cost effective for us to pay their premiums, copays, or deductibles every month and allow them to stay within their own private health insurance than to have them go to a Ryan White care-funded provider.
That makes sense.
Yes. So it's very cost-effective that way. And we also fund other services, ancillary supporting services, such as oral health, which is, we have a very good program. It's very robust. And we also fund programs such as mental health and substance abuse, because we often find that when clients come in, especially those who have been out of care for a great deal of time, a lot of times have co-infected conditions, or they do have mental health or substance abuse problems. So we're able to kind of give them comprehensive, holistic care that way in addressing all areas of their disease to hopefully improve their health overall.
Absolutely, improve their health, their quality of life, and
Exactly.
and the futures to come, right? That might be impacted as well with HIV and/or AIDS.
Right.
So with that being said, Lisa, how does your organization interact with the folks, right? When they come in, their clients, and they have these needs, is there any actual face-to-face interactions that they have? Do you have clinicians that work with some of the clients?
We do. On the Planning Council, the Care Council does have clinicians on the Planning Council, so they are there, bringing the voice of their patients. We also have service providers, some of the substance abuse providers, the mental health providers, case management providers are all present and members of the Planning Council.
That's fantastic. So not only does the Ryan White program help with some financial supplementation when needed, it sounds like there's some emotional support and advocacy being done as well through your organization. Is that fair to say?
We don't really provide any emotional support necessarily. We do meet, the planning body more plans the different services and allocations more so than provide like a support services function.
But being the voice for the community that is impacted by this disease, would you say?
Yeah, they can, the voice of the community is heard through our Care Council and our associated committees.
Got it. Now I'm clear. That's awesome and that's good. And how does one, if they want to, be part of the Care Council, how would they do that? Is there a lot of requirements that would make them be good as a volunteer on the Care Council? Is there training that they get? Is there an orientation program?
Well, we do our best to support our Care Council members, so we do have all of that.
Okay.
We're always looking for new members to join the Care Council. People are appointed to be on the Care Council, but all they have to do is fill out an application, and they can go to our website to get to fill in the application online. It comes right to us. Everything is confidential through our membership process. So no one knows anything that is written on the membership application except for our staff, which is myself and another planner. So if someone were to disclose something on that application about being positive, or nobody knows that unless they tell them.
Okay.
Nobody else knows that except for us. So they fill out the application, it comes to us, we do have a membership interview, and we have a whole committee that oversees that part of the process. They bring new people on board, and there's not really any strict requirements we have for people who are going to join. We're open for volunteers, and our area, our group is supposed to be representative of the local epidemic. So we do want to keep it looking like our local epidemic looks. So we do try to keep, the right mix of individuals on there. But I don't know that we've ever turned anybody away who's interested and who wants to be a part.
That's
Once they
right.
submit that application, we get them on, and then we have member training and orientation, because some of these pieces you might see can be very confusing. We start talking about where the funds are going and allocations, and Washington D.C. and all of that stuff and different services. So we support our members through orientation and through yearly trainings, a couple trainings a year. And then there's dedicated staff, there's myself and our Ryan White planner, who are basically there for our members anytime they have a question, or if they're confused about something, they don't understand one of the votes that's going to be coming up, then they can call us, and we're there to help them.
And Lisa, would you say that the mix of volunteers are all over the board in terms of ethnicity and age? Do we have young, old, white, black, male, female that are volunteering for the Care Council?
Yes, absolutely. Right now we have about 25 members of the Care Council, and we're actually mandated to reflect our local epidemic in the membership of our Care Council. So the Health Resources and Services Administration, which is our actual funding source from the federal government, mandates that if the epidemic is, say, 40% amongst Black people, that we have a 40% Black representation on our Care Council.
Sure.
So there is a very diverse group. We have men, women, transgendered members. We have Black, white, Hispanic, Asian, young and old. We welcome everyone. We're always happy for a volunteer, and we are a very diverse group, and I think it brings great communication and great interaction amongst our members.
Absolutely. It sounds like HIV and AIDS is no respecter of person. And so Aubrey, just the same question to you, and then we're going to take a quick break, which is, how does that look when we think about the demographic of the clients, right, that need the care?
I would say it's very reflective, Shay, in terms of the clients that we're actually serving through the program. We have an adolescent program, for example. We have a pediatric program as well. We have the funding we have also targets specific minority populations that are disproportionately impacted. So I would say, again, to echo what Lisa said, it's a very diverse group that we reach through the program funding overall.
Well, you guys are doing so many wonderful things for this program, but there's more for us to learn. We'll be back in a moment after this quick break.
Hands can do incredible things. Now they can even help save a life with hands-only CPR. If you see an adult suddenly collapse, just call 911, then push hard and fast in the center of the chest until help arrives. Learn more at handsonlycpr.org.
Welcome back to the Hillsborough Health Series. I'm Shay Parker, and again with me is Aubrey Arnold. Great to again have you with us. We're learning so much today. And Lisa Nugent, learning so much. And so our next question really has to do with eligibility. And so someone's been listening to all the wonderful services that you guys have, and it's wonderful in terms of what the organization is doing. But I think with the Ryan White program, one might be thinking, how do I know if I'm eligible to receive the service?
Basically, we follow a statewide eligibility process that is mandated by the Florida Department of Health. The income guidelines, there are income guidelines and other guidelines associated with it, but basically we can assist those who are up to 400% of the federal poverty level, which is actually a very generous guideline in terms of other social service programs. So we are able to help some clients who otherwise would probably fall out of that safety net that we were talking about earlier in terms of the income limits. What happens is if I am a newly diagnosed person, a newly diagnosed positive person in the area, we have several contracted case management agencies that they can contact. Typically, our case management agencies, which are located throughout the four-county area, also do prevention, counseling, and testing. So the linkage is already established there, and it's very seamless in order for someone to be newly diagnosed after they've been tested positive. To get into care. We do our best we focus a lot of our effort on linkage and ensuring that those linkages are there. So they're referred to a medical case manager who essentially becomes kind of their home base and their broker of services. And what they will do is do an assessment or an initial triage on them to determine at what level of care they need in terms of what services that they're looking for. Some clients may be looking just for, let's say, oral health, or maybe some counseling. Or possibly an insurance premium paid like we were talking about earlier, which is one of those services that we offer, especially those who are still working and at the higher income levels. So depending on the service, they go and they see one of our contracted medical case managers, who then becomes their broker and directs them and helps guide them and navigate them to the appropriate services that they need, whether it be at one of the clinics that we fund, or for medication assistance, or whatever the service is that we fund through Ryan White. One of the things that I should also note when talking about the eligibility process in general is that Hillsborough County government does not actually provide these services directly for the HIV and AIDS clients that we serve.
Right.
All of the services that we fund through Ryan White are all contracted. In fact, we have 12 different contracted providers throughout our network, as I call it, over the four-county EMA, and those are the actual providers of the services. Some people have the impression, because we are a part of county government, that we actually provide the direct services, whereas we do not. We actually take a different concept, and all of the services that Ryan White provides are actually contracted out through other service providers.
And that's wonderful to have a lot of ancillary partners, right?
Correct.
To do the specific expertise for that, whatever that area of need is, that it can be handled, right?
Exactly.
Because we know how
We
that
go
can be
to where the
cumbersome.
experts are, and
Makes
that's
perfect sense.
correct.
So there's probably so many different people that have benefited to date of your different services. Do you have a number in mind in terms of how many clients your organization has helped to date for this year?
Currently, we have about 4,200 for this year. That if I were to tell you right now an active number of clients, it would be probably about 4,200.
Wow.
And again, that encompasses the entire four-county service area. And again, I think when you think about the prevalence rates of about 10,000, we're serving maybe 4,200 or slightly less than half of those that are infected. We're serving a large number of HIV and AIDS clients over the four-county EMA.
Wow.
And again, that would be through the network that we've established of the 12 different service providers.
Okay.
Periodically, those service providers do, we procure the services. That's another task that my office is responsible for in terms of the provider procurement. They're given agreements that have annual renewals, and typically over time, every few years, we go out for procurement in terms of a bid document is released and we put out services for bid. In fact, we have a procurement out currently for some of our service funding.
Oh, wow.
And that's kind of how it works. So it's competition. Competition breeds, I think, better services, better quality services oftentimes. And so that's the kind of environment that we operate the program through.
And so, Lisa, I would imagine that with these 4,000 plus that are currently being served in the organization, how does the Care Council get involved? Again, there's not a lot of face-to-face interaction, but I'd imagine that there's probably a more formal structure that the Care Council has in order to help with some of the client needs, even indirectly.
Yes, there are. And the Care Council is our main committee. It's our most formal committee. But underneath the Care Council, there's actually 7 other committees that meet on a monthly or bi-monthly basis. And those different committees work on different pieces of what the Planning Council is responsible for. So you heard Aubrey mention earlier some of the service priorities, and that ambulatory outpatient care or medical care was one of our priorities. Well, it's determined to be a priority because of the Care Council and its committees.
Oh, so then is it the collective of all the committees that reviews every year what the most prevalent needs are, and then that's how they redetermine the priorities?
Exactly. So the committees do the work, do the actual business work on, whatever it is that's coming up. If it's what our priorities are for the year. The committee would do research, they would do a needs assessment, they would look at the numbers of people who are infected and affected in the area, and they would determine which services should be prioritized in which order. So that would come from a committee, and then it would go to the Care Council for a final vote. But all of those things are done locally.
Wow.
In addition, what amount of money is given to each service is done through the Care Council and its committees as well.
Got it.
Again, a committee works on it and then sends the recommendations to the Care Council for the final vote.
Sure, and I'm sure some of that probably is determined by the priorities, right? So some
Exactly.
priorities may have a different need that's greater than some of the other ones in terms of the weight distribution of the funding. So with the other 7 committees, the subcommittees, would that be fair to say, what are they made of? How do they look? What do they do? What are their functions? Can you share about a few of them, those subcommittees?
Sure. We have our Planning and Evaluation Committee, which talks about our needs assessment and comprehensive plan. They look at kind of where those service priorities are going to be, which of our core services are going to be prioritized and determine in which areas it's going to be determined by. We have a Resource Prioritization and Allocation Committee, which looks at the funding. So they're the ones who are looking at the $10 million that comes from the federal government, and which areas do we want to put that? So do we want to put, where do we want to put, how much do we want to give to medical care? How much do we want to give to oral health? How much do we want to give to all of those different pieces? And then we have some other committees that are very much client-centered, such as our Community Advisory Committee, which is a very client-centered committee where any client could come in who's being served by Ryan White or not being served by Ryan White and could talk about any issue that they're having so that they can bring that issue forward to us and that we can try and work on it. We also have a Women, Infants, Children, Youth, and Families Committee, which meets specifically to talk about the special needs that affect women and infants and children in our community who are living with HIV and AIDS. So there's basically a committee for everybody.
It sounds like it, and that's wonderful because it's all inclusive.
Yes.
Well thought through, which is fantastic too. One of the things that I was thinking about is you mentioned the women and the children and the 4,200 plus that has been being served, Aubrey. Is there a success story that you probably can share that would be something that would be representative of what some of the, the clients go through or have gone through?
I think some of our biggest success stories come from folks in the HIV community that I've met over the years, some longtime dedicated volunteers and other stakeholders. I can tell you that a lot of the people that we have served over the years through, say, someone who's newly diagnosed in the area and goes in for services, it may be housing, it may be, again, the health insurance premiums, or it may be something as basic as medical care. Generally, because of the climate and the culture that we've been able to foster and kind of build and grow upon with Ryan-White over the years, those people generally leave, if they leave our area, healthier and certainly more knowledgeable and educated about the disease and its impact and how they can live with it and manage it. I think that the best thing that we can do as a community when interacting with the HIV population in terms of services is to give them knowledge, educate them. If they are having issues with access, try to remove some barriers and just give them some tools that will allow them to go to a higher level with their disease and manage it and control it. If we can have an impact that way on the general HIV population, I think we've been successful.
Absolutely, and I'm sure someone listening here today is touched by this, and they may want to be a member of the Care Planning Committee. And what would they do, the Care Council? Is there a website that they could go to, Lisa, to find out more?
Yes, we do have a website. It is www.thecarecouncil.org. That has all of our meeting lists on it. And all of our meetings are open to the public and anyone can attend any of our different committees at any given time. And it also has our membership application and some more information about the Planning Council. We also have a Ryan-White Facebook page, which is the West Central Florida Ryan-White Care Council. If you just search for that on Facebook, you can come to our page, which also has a lot of different announcements about meetings, and we try to share some things that are happening in the HIV and AIDS community worldwide there. So
awesome, great. And I'm sure some might be thinking, hey, would it take a lot of time for me to be a volunteer? Can they do a little bit of time or a lot? Is there flexibility around the number of hours they put into the work?
There always is.
That's great.
Usually with our members, we want them to be a member of the Care Council and then one other committee. So it's a few hours a month that are dedicated to being a Care Council member.
Well, we've learned so much on the show today. I personally have learned a lot, and I want to thank you again, Aubrey, for being here, and Lisa for coming and sharing so much about the Ryan-White program.